Contingency management is an intervention primarily used in the treatment of addiction that involves providing incentives to encourage positive behaviors, including being engaged in treatment activities. The following videos are demonstrations that address key principles on how to implement contingency management effectively and competently. One of the first steps in developing a contingency management program for an individual or a group is to define a target behavior. Target behaviors to be incentivized through contingency management need to be specific, objective, and observable. Often clients will express treatment-related goals that they want to achieve, but these goals are vague, lack direction, are not clearly objective, or are unattainable within a reasonable time frame. It can be unclear how some of these behaviors would be observed. In these instances, it is important that the contingency management provider works with the client to operationalize the desired goal. In this example, the client wants to revisit their interest in drawing as part of a goal to increase their self-care. Pay attention to how the provider helps the client to develop a clear target behavior that they're able to verify.
Hi Matt. So last week we talked about the importance of practicing self-care, and a lot of times that will involve doing things that make us feel good. Is there anything that you used to do in the past that made you feel good, or something that you'd want to re-engage in or you can do more of?
Yeah, I used to do a lot of drawing, like growing up as a kid and a teenager. I'm actually pretty decent at it, but along the way, just with my addiction problems and feeling depressed, I just stopped at some point, and it's one of those things I know if I did, I would feel good, and but I've just been in a rut. But I guess that's something I should be doing more of.
Is that something that you would like to set a goal around?
Yeah, sure.
Okay. What would you need to get started with that? Any specific items?
Well, I think I have everything. I have a sketch pad and like artistic like pencils that I can use, so I'm good there.
So tell me, what might you draw?
I kind of just look out the window and do like a quick like sketch of what I see.
Okay, that sounds interesting. How long would that usually take you?
I mean, a lot of times like as quick as like 10 minutes or maybe longer if I want to like work a bit harder or add more detail.
So how about we set a goal of drawing at least 3 times a week for at least 10 minutes? Does that sound like something that would be manageable for you?
Yeah, I think so.
All right, so here's what we can do. How about on Mondays, Wednesdays, and Fridays, you send me some kind of proof that you have either a work of art in progress or something that's completed. And I want you to remember that we have to be strict when checking compliance, just so we're fair to everyone. How about you send me a before and after picture of each artwork that you do, either by text or by email, before midnight on Monday, Wednesday, and Friday. Also let me know what time you started the drawing and what time you completed it. The days that you choose to draw on are completely up to you. I just want to make sure that I get that verification on Monday, Wednesday, and Friday. Does that make sense?
Yeah, that's fine. Yeah, that sounds good.
I will send you a link to the prize draw, usually within a few hours of receiving your verification, but that will all depend on when I receive the verification. If you happen to send it at 5 p.m. when I'm out of the office, I will usually send it the next morning as soon as I'm back in. Does that make sense?
Yeah, I think so.
Okay, great. I will send you a printout of what we've agreed upon, as well as the prize draw rules that we discussed earlier. If anything is unclear, please let me know. I really look forward to seeing some of your illustrations.
Okay, sounds good. Notice how the contingency management provider took the client's goal of wanting to draw more and specified that goal, made it attainable for the client, along with describing how exactly that behavior would be observed, and provided them with additional instruction materials. It is crucial that the client have a clear understanding of how to demonstrate the target behavior so that they know how to earn incentives. Another issue to keep in mind is that the target behavior be actionable, or in other words, not a dead man goal. In short, a dead man goal is a goal that can be done by a dead person. A client saying that they are not going to use meth is an example of a dead man goal. A way to make that actionable would be to have the client present to the clinic weekly to provide a urine sample for analysis to demonstrate that there are no methamphetamines in their system.